My name's Priyo, and I started the MSc in Transcultural Mental Health Care in 2010, and I was doing it as a part-time student whilst working full-time as a psychiatrist. Firstly, I mean, being obviously a transcultural mental health care programme was during one of the modules a lot of emphasis on looking at cultural aspects of mental health. So I found that greatly helped me in terms of looking at, in terms of my general day-to-day kind of clinical management of patients. I was able more to look at patients from a kind of cultural perspective. When I did this course over the first year where I came to the university, I met people who are from very different backgrounds, very different age groups, and from totally different countries. For example, there were a lot of students from Turkey, there were students from Colombia, fellow students from Turkey, fellow students from Colombia, fellow students where I don't think I'd ever spoken to anyone who was Turkish before or Colombian before. So it's meeting totally different people, different ways of thinking, different ways of studying, different ways of talking, different ways of eating. It's a whole myriad of cultures, and that I think I greatly benefited from as well. And the final thing I benefited from the course was my dissertation. I was doing it on radicalisation through the department, and that allowed me to, so I finished my dissertation, then there's an opportunity to extend that, to do further work on radicalisation in the department for a year. So it's allowed me to take a whole year out of work and to kind of do a sabbatical in research on radicalisation, and that's obviously going to greatly help with my research skills and time management skills and just doing something different. So that's provided me a great opportunity as well. So those are the main things I think I've benefited from doing the MSc in Transcultural Mental Health Care. In terms of the kind of research module, Module 3, we had to do a dissertation on that, so that obviously helped kind of actually doing my own original piece of research. We had to critically appraise a journal article, and we had to do about 12 of them. And it's something that, like, when you're working as a psychiatrist, everyone seems to think they know when they read a journal article, they read a paper, they think they know what they're talking about, and you think you pretend to understand what's going on. But often people don't, and I felt that after doing a series of critical appraisal exercises, it completely changed the way I viewed research. In the future, I hope to maybe one day do a PhD in the kind of, maybe on topic of radicalisation and taking that forward even more. I would definitely recommend them to take it, and I think one of the things in terms of this MSc, speaking from the part-time perspective, the first year is very kind of structured. So you've got your lectures, you've got your essays to hand in, you've got your critical appraisal articles to do and things like that. So it's all structured. So it's very easy to do. You've got deadlines and stuff. The second year is just your dissertation. You don't come in, you're not in contact with anyone from the course, and you just kind of you forget about your dissertation, and then you realise you have to hand it in August, and it's quite a stressful time actually. So I think more time management needed in the second year would be highly recommended from me.